What does the nurse do if a patient presents with shortness of breathing?
His saturation is 85. He's tachypneic and using accessory muscles. I see some cyanosis.
Prepare for STAT EKG and STAT chest X-ray.
STAT EKG and STAT chest X-ray.
The patient is breathing rapidly. Would you like to order an ABG?
A doctor may order an arterial blood gas or ABG test to assess a patient's respiratory, metabolic, and acid-base status, especially when a patient presents with shortness of breath, respiratory distress, or signs of hypoxia. Here's why a doctor would order an ABG. To evaluate oxygenation, PAOK, to see how well oxygen is getting into the blood from the lungs. A low PAOK could indicate hypoxemia, pneumonia, pulmonary embolism, and ARDS. To assess ventilation CO2, to check how effectively the patient is removing CO2 through breathing. High or low CO2 can indicate hypoventilation, increased CO2, COPD, drug overdose, neuromuscular issues, hyperventilation decreases CO2, anxiety, sepsis, early asthma. To check acid-base balance baran, to detect metabolic or respiratory acidosis/alkalosis, which can occur in sepsis, renal failure, diabetic ketoacidosis, respiratory failure.
To decide if the patient needs oxygen, non-invasive ventilation like BiPAP, or intubation.
To monitor how a patient is responding to treatment. To help diagnose underlying conditions.
I'm going to put this mask on you. It will help you breathe more easily. Just try to relax.
Doctor, the airway is compromised. Do you want to consider intubation?
All right, just a little poke. We're getting samples for BNP and D-dimer.
Okay.
Administering bronchodilators and IV corticosteroids as prescribed. Doctor, I've assessed Mr. Smith. He shows signs of fluid overload. Preparing to administer IV Lasix 40 milligrams as ordered.
We're giving you some epinephrine. It will help you breathe.